Hello, I'm Dr. Stephen King, Residency Director at AHEC South Arkansas. I'd like to talk to you this evening about an innovative way to perform intubation. And that's my daughter Mary, who will be my assistant tonight.
Assistant? I'm watching a movie.
What I'd like to talk to you about is intubation. And one of the difficulties in intubation that we have is direct line of sight is necessary whether you're using the Macintosh or the Miller blade. Sometimes that is difficult. There is a new device called the King System's AirTraq, and that obviates the need for direct line of sight. It's got a curvature that fits directly into the airway, and through this lens you look and you can directly visualize the epiglottis and the vocal cords. It's very easy to use. A couple of the differences are you don't have to sweep the tongue to the left side in order to visualize the vocal cords. You just slip this into the oropharynx and slip this tip in one of two ways. You may slip it right behind the epiglottis, just like you would the Macintosh, or you can go over the epiglottis just like you would a Miller. You need to preload this channel on the side with your ET tube. Often you'll need a little bit of KY jelly just to lubricate things up there. And so you're just going to slip this into the side, and as I say, with a little KY jelly it'll go a little more easily, and then load it up right to the tip. Your light source, you turn your light on here, and it'll take 30 to 60 seconds. It'll flicker initially until the anti-fog device is activated. When you're ready to intubate, you may need to bring the patient's jaw forward, and you might want to actually lubricate this part of the airway as well. Insert it into the oropharynx, and then when you look down the lens, you will see this end enter the vallecula, and at that point you may need to lift the whole complex up. You will usually see the vocal cords, and at that point you look into the lens just as I'm doing now, and then you will push this forward. And often all you have to do is push it forward and it'll go right into the airway. There is a little part of the ET tube here, and I recommend you use the one with this device, and you can turn this slightly if needed, although you may not even need to do that. So you go ahead and insert it forward and it'll go right into the airway. When you have that, you just break it loose right here, carefully, being careful not to push the ET tube forward or pull it back, and then gently slip this out and put it to the side. Go ahead and use your usual measures to make sure that this is in the airway. Listen to the lateral sides of the patient's chest, and then use a CO2 detection device as well. In a difficult airway, it will make your life much, much easier. I recommend you plan in advance for failure, so that in advance you know where this device is if you are having trouble with getting your airway in the traditional manner. I will attach to this email another site that has a video device that shows you in a little more detail how to use this device. There are other devices that are excellent and make accessing a difficult airway much easier. And we'll learn about those more in the future. Thank you for your attention tonight. Good night.